long term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 65, Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy: topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal, topical azelaic acid, generally considered safe, topical clindamycin, some. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end-of-work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary.
Welcome to this tranquil space. Take a slow, deep breath in and gently release. Let your shoulders drop. Let tension melt away. Today, we're going to explore one of the most powerful yet underrated tools for healthy, beautiful skin: sleep. Sleep is when your body repairs, regenerates, and renews itself. This includes your skin. While you rest, your skin is working hard, producing new cells, repairing damage, and restoring itself from the day's stresses. When you deprive yourself of adequate sleep, you deprive your skin of this essential restoration time. Let's understand what happens to your skin during sleep so you can appreciate why those hours of rest are so valuable. During deep sleep, your body increases production of growth hormone, which is essential for cell repair and regeneration. Your skin cells reproduce faster at night than during the day. This accelerated cell turnover means old, damaged cells are replaced with fresh, new ones. Blood flow to your skin increases during sleep. This enhanced circulation delivers more oxygen and nutrients to your skin cells while carrying away waste products and toxins. This is why you often wake with a natural glow after good sleep. Your skin has been bathed in nourishing blood flow all night. Your body produces more collagen during sleep. Collagen is the protein that keeps your skin firm and elastic. More collagen production means stronger, more resilient skin that's better able to resist the formation of wrinkles and sagging. Your skin's barrier function strengthens during sleep. The skin barrier is your protection against environmental damage, moisture loss, and irritants. A strong barrier means healthier, more comfortable skin that's less prone to sensitivity and dryness. Cortisol levels drop during sleep. Cortisol is your stress hormone, and chronically elevated cortisol can break down collagen, increase inflammation, and worsen skin conditions like acne. Sleep gives your body a break from stress hormones, allowing your skin to heal and restore balance. Now let's look at what happens when you don't get enough sleep. The effects on your skin are real and visible. After just one night of poor sleep, you might notice your skin looks duller, puffier, and more tired. Dark circles under your eyes appear or deepen. Fine lines look more pronounced. Your complexion seems lackluster. Chronic sleep deprivation has more serious effects. Your skin ages faster. Collagen breaks down more rapidly, leading to increased wrinkles and sagging. Your skin barrier weakens, resulting in increased sensitivity, dryness, and irritation. Inflammation increases throughout your body, which can worsen acne, rosacea, eczema, and other inflammatory skin conditions. Your skin's ability to heal slows down. If you have acne, breakouts last longer. If you have wounds or irritation, they take more time to resolve. Your skin simply can't repair itself efficiently without adequate rest. Even your skin's hydration decreases with poor sleep. Studies show that people who sleep poorly have more transepidermal water loss, meaning their skin loses moisture more rapidly. This leads to dehydrated, tight, uncomfortable skin. So how much sleep do you need? Most adults function best with 7 to 9 hours per night. Some people need slightly more, others slightly less. The key is how you feel and function during the day. If you wake naturally, feeling refreshed, have stable energy throughout the day, and don't rely heavily on caffeine, you're probably getting enough sleep. But it's not just about quantity. Quality matters too. 7 hours of deep, uninterrupted sleep is more restorative than 9 hours of restless, fragmented sleep. Let's talk about how to improve your sleep quality for the benefit of your skin and overall health. Establish a consistent sleep schedule. Go to bed and wake up around the same time every day, even on weekends. Your body thrives on routine. This consistency helps regulate your circadian rhythm, your internal biological clock, which governs not just sleep, but also many aspects of skin cell function and repair. Create an evening wind-down routine. About an hour before bed, begin transitioning toward rest. Dim the lights in your home. Bright light, especially blue light from screens, suppresses melatonin production and signals your brain to stay awake. If you must use devices in the evening, enable blue light filters or wear blue light blocking glasses. This wind-down time is perfect for your evening skincare routine. Cleansing your face, applying your nighttime products, these activities can become a soothing ritual that signals to your body it's time to rest. Engage all your senses. Notice the texture of your cleanser, the scent of your products, the sensation on your skin. This mindful attention brings you into the present moment and calms your nervous system. Keep your bedroom cool, dark, and quiet. The ideal temperature for sleep is around 60-67 degrees Fahrenheit. Cooler temperatures trigger your body's natural temperature drop that promotes sleep. Use blackout curtains if light enters your room. Consider a white noise machine or earplugs if you're sensitive to sound. Your bed should be comfortable and reserved primarily for sleep and intimacy. Avoid working, eating, or watching television in bed. You want your brain to associate your bed with rest, not activity or stress. Be mindful of what you consume, especially in the hours before bed. Caffeine has a half-life of about 5 to 6 hours, meaning half of it is still in your system that long after consumption. If you're sensitive to caffeine, avoid it after early afternoon. Alcohol might make you drowsy initially, but it disrupts your sleep cycles later in the night, preventing you from reaching deep, restorative sleep stages. If you drink, do so in moderation and earlier in the evening. Large meals close to bedtime can cause discomfort and disrupted sleep. Aim to finish dinner at least 2 to 3 hours before bed. If you need a small snack before sleep, choose something light and easy to digest. Exercise supports better sleep, but timing matters. Vigorous exercise close to bedtime can be stimulating and make it harder to fall asleep. Try to finish intense workouts at least 3 to 4 hours before bed. Gentle stretching or restorative yoga in the evening, however, can actually promote relaxation and better sleep. Manage stress and worries before they reach your bedroom. If your mind races at bedtime, try keeping a journal by your bed. Spend 10 minutes writing down your thoughts, worries, and tomorrow's to-do list. This brain dump can help clear your mind. Once your thoughts are on paper, give yourself permission to set them aside until tomorrow. If you can't fall asleep after 20 minutes, get up and do something calm and quiet in dim light until you feel sleepy. Don't lie in bed frustrated and tossing. This creates negative associations with your bed and can worsen sleep problems. Let's talk about your pillow and pillowcase because these affect your skin too. Your face spends hours pressed against your pillow every night. If your pillowcase is rough, it can cause friction and contribute to sleep wrinkles over time. Silk or satin pillowcases are gentler on your skin and hair. They create less friction and don't absorb moisture from your skin the way cotton does. Change your pillowcase regularly, ideally twice a week. Your pillowcase accumulates oil from your skin, product residue, and bacteria. A clean pillowcase means less exposure to these potential pore cloggers while you sleep. Try sleeping on your back if possible. Side sleeping and stomach sleeping create pressure and compression on your face, which over years can contribute to wrinkles and asymmetry. Back sleeping keeps your face free from. Welcome to this peaceful, supportive space. Take a deep breath in, feeling your body relax completely. Exhale slowly, releasing any worry or tension. Today we're going to talk about something that affects so many people with such tenderness and care. How to reduce acne gently and safely without harsh treatments or aggressive approaches that can damage your skin. If you're dealing with acne, first know this: you are not alone, you are not doing anything wrong, and your skin is not broken or bad. Acne is an incredibly common skin condition that affects people of all ages. It's not a reflection of your hygiene, your worth, or your self-care efforts. It's a complex condition influenced by hormones, genetics, environment, and many factors beyond your control. The gentle approach to acne is about working with your skin, not against it. It's about supporting your skin's natural healing processes rather than attacking the acne with harsh, stripping treatments that often make things worse in the long run. Let's explore how to care for acne-prone skin with compassion and effectiveness. First, let's understand what acne actually is. Acne occurs when hair follicles become clogged with oil and dead skin cells. This creates an environment where bacteria can multiply, leading to inflammation and the formation of pimples, blackheads, or cysts. Various factors contribute. Hormonal fluctuations, stress, certain medications, diet, and genetics all play roles. Understanding this helps you approach acne treatment rationally rather than emotionally. Your skin isn't misbehaving. It's responding to internal and external factors. Your job is to support it in clearing those clogged pores and reducing inflammation, gently and consistently. The foundation of gentle acne care is proper cleansing without over-cleansing. This balance is crucial. You need to remove excess oil, dead skin cells, and bacteria. But you don't want to strip your skin so harshly that you damage your barrier and trigger more oil production. Use a gentle pH balance cleanser formulated for acne-prone skin. Look for cleansers with salicylic acid or benzoyl peroxide, but in low concentrations, 2% salicylic acid or 2.5% benzoyl peroxide are effective, yet gentle. These ingredients help unclog pores and reduce bacteria without being overly harsh. Cleanse once in the evening to remove the day's accumulation. In the morning, many acne-prone skins can simply rinse with water. Over-cleansing, even with gentle products, can backfire by irritating your skin and triggering more oil production. When you cleanse, use lukewarm water and gentle circular motions with your fingertips. Don't scrub, pick, or use harsh tools. Treat your skin with tenderness, even though you might feel frustrated with it. Aggression toward your acne only creates more inflammation. After cleansing, the next step is treatment. Gentle acne treatment uses proven ingredients at appropriate concentrations, applied consistently but not aggressively. Salicylic acid is a beta-hydroxy acid, BHA, that penetrates into pores, dissolving the oil in dead skin cells that cause clogs. It's oil-soluble, making it particularly effective for acne. Use products with 0.5 to 2% salicylic acid. You don't need higher concentrations. They're more likely to irritate without being more effective. Start by using salicylic acid every other evening, Apply it after cleansing on dry skin, then wait a few minutes before applying moisturizer. As your skin builds tolerance, you can increase to nightly use if needed. But many people find every other night use sufficient and less irritating. Benzoyl peroxide is another effective acne treatment. It kills acne-causing bacteria and helps unclog pores. Use 2. 5% concentration. Research shows it's just as effective as higher concentrations, but much less irritating. Apply it as a spot treatment or thin layer over acne-prone areas after cleansing. Be aware that benzoyl peroxide can bleach fabrics, so use white towels and pillowcases, or let it fully absorb before your face touches fabric. Some people use both salicylic acid and benzoyl peroxide, but not at the same time. You might use salicylic acid in the morning and benzoyl peroxide at night, or alternate them on different nights. Listen to your skin. If it becomes irritated, scale back to using just 1. Niacinamide is a gentler option that supports acne treatment beautifully. It reduces inflammation, regulates oil production, and strengthens your skin barrier. A serum or moisturizer with 5% niacinamide can be used daily and work synergistically with other acne treatments. Retinoids, including over-the-counter adapalene or prescription tretinoin, are highly effective for acne. They increase cell turnover, preventing dead skin cells from clogging pores. However, they can be irritating, especially initially. If you use a retinoid, start with the lowest concentration, apply it only 2 to 3 times per week at first, and always use it with adequate moisturization. Retinoids are a long-term strategy. They take several months to show full effects. Now let's discuss moisturizing for acne-prone skin. This is crucial and often overlooked. Many people with acne skip moisturizer, fearing it will make them more oily or cause more breakouts. This is a mistake. Your skin needs hydration, even oily acne-prone skin. When your skin is dehydrated, it produces more oil to compensate, potentially worsening acne. When your skin barrier is compromised by harsh treatments, it becomes more vulnerable to irritation and infection. Moisturizer addresses both issues. Choose a lightweight, oil-free, non-comedogenic moisturizer. Gel or gel cream formulas often work well. Look for ingredients like hyaluronic acid for hydration, niacinamide for oil regulation and calming, and ceramides for barrier support. Apply moisturizer after your treatment products have absorbed. Don't skip this step, even if your skin feels oily. Proper hydration actually helps regulate oil production over time. Sun protection is absolutely essential when treating acne. Many acne treatments, particularly retinoids and acids, make your skin more sensitive to sun. UV exposure can also darken post-acne marks, making them take longer to fade. Use a non-comedogenic, oil-free sunscreen daily. Mineral sunscreens with zinc oxide work well for many acne-prone skins, as zinc has mild anti-inflammatory properties. Let's talk about what not to do when dealing with acne. Don't pick, squeeze, or pop pimples. This is perhaps the hardest advice to follow, but it's crucial. Picking spreads bacteria, causes inflammation, damages your skin, and leads to scarring. If you have a pimple that's ready to drain, do so with clean hands and gentle pressure only, then immediately apply a spot treatment. But mostly, hands off. Don't over-exfoliate. It's tempting to scrub away acne, but physical exfoliation can spread bacteria and irritate inflamed skin. Chemical exfoliation with salicylic acid is gentler and more effective. Limit exfoliation to 2 to 3 times per week at most. Don't use multiple harsh treatments simultaneously. Layering several strong acne products causes irritation, damages your barrier, and often makes acne worse. Choose one or two treatments and use them consistently but gently. Don't expect instant results. Acne treatment requires patience. Most treatments take 6 to 12 weeks to show significant improvement. This slow timeline is frustrating but normal. Consistency matters more than intensity. Let's discuss lifestyle factors that support gentle acne treatment. Clean pillowcases and towels prevent reinfecting your skin with bacteria. Change your pillowcase at least twice weekly, more often during active breakouts. Use a clean towel to dry your face, or dedicate a small towel just for your face that you wash frequently. Avoid touching your face throughout the day. Your hands
or trigger acne. The ingredients matter significantly. Lightweight hydrating ingredients like hyaluronic acid, glycerin, and humectants hydrate without being occlusive or pore clogging. Niacinamide hydrates while also having acne-fighting properties. Centella asiatica, SICA, soothes irritation and supports skin barrier function. Ceramides strengthen your skin barrier, which is particularly important when using strong acne treatments. Avoid heavy oils and butters if you have acne-prone skin. Coconut oil, shea butter, and petroleum jelly can clog pores in susceptible individuals. However, some facial oils specifically designed for acne-prone skin can be beneficial. Jojoba oil, squalane oil, and rosehip seed oil are lightweight and non-comedogenic for most people. If you choose to use facial oil, use sparingly, just a few drops mixed into your moisturizer or applied as the last step of your routine. Texture matters when choosing a moisturizer for acne-prone skin. Lightweight gels absorb quickly and won't leave your skin feeling greasy. Hydrating lotions provide more hydration than gels while still being lightweight. Creams are heavier but may be necessary during winter or if your skin is severely dry from acne treatments. Everyone's needs are different. Experiment to find what works for you. Application technique is important. Apply moisturizer to slightly damp skin immediately after cleansing or applying treatments. This allows the moisturizer to lock in hydration from the water on your skin. Use about a quarter-sized amount for your entire face. Warm it between your palms, then gently press it into your skin using your fingertips. Don't rub or massage aggressively, as this can irritate acne lesions. Daytime and nighttime moisturizing might differ. During the day, use a lightweight gel or lotion moisturizer that won't make your skin feel greasy under makeup or throughout the day. Many people use a sunscreen as their daytime moisturizer since sunscreen provides hydration and protection simultaneously. At night, you can use a slightly richer moisturizer if desired, though many people use the same moisturizer day and night. If your skin is very dry from acne treatments, you might use the layering or sandwich method. Apply your treatment, retinoid, benzoyl peroxide, salicylic acid, wait 20 minutes, apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. This significantly reduces irritation and dryness while maintaining treatment efficacy. In winter or dry climates, increase moisturizing frequency or richness. You might apply moisturizer twice daily or use a richer nighttime formula. Some people add a facial oil, just a few drops, over their moisturizer for extra hydration during very dry periods. In summer or humid climates, you might reduce moisturizer richness, using only a lightweight gel. If your skin is extremely oily and acne-prone, you might feel you don't need moisturizer. However, most very oily skin is actually dehydrated. The skin is overproducing oil to compensate for internal dehydration. Using a lightweight hydrating moisturizer often actually reduces oil production by satisfying your skin's hydration needs. Sunscreen functions as both protection and moisturizer. Many quality sunscreens for daily use include hydrating ingredients. Use a sunscreen as your daytime moisturizer, applying it after your morning skincare routine and before makeup. Reapply every 2 hours if you'll be in the sun, or use a sunscreen powder for convenient reapplication over makeup. Hydrating masks once or twice weekly provide intense hydration, supplementing your regular moisturizer. Sheet masks or cream masks with hydrating ingredients like hyaluronic acid, glycerin, or honey can be applied for 10 to 20 minutes, then removed. This boosts hydration without requiring daily changes to your routine. It's possible to over-moisturize. Applying excessive amounts or using too rich formulas can clog pores and worsen acne. Use appropriate amounts, about quarter-sized for your face, and choose formulations suitable for your skin type. If your acne worsens after starting a new moisturizer, discontinue it and try a different product rather than assuming moisturizer itself is the problem. Guide 11. Sun Protection and UV Damage Prevention for Acne-Prone and Treated Skin. Sun protection is non-negotiable for anyone with acne or using acne treatments, yet it's frequently neglected. Understanding UV damage, sunscreen types, and proper application is essential for protecting your skin from damage while treating acne. UV radiation from the sun damages skin through multiple mechanisms. UVB rays cause sunburn and skin cancer. UVA rays penetrate deeply, causing aging, wrinkles, and skin cancer. Both types of UV radiation increase inflammation, which worsens acne. Additionally, UV exposure causes post-inflammatory hyperpigmentation, dark marks remaining after acne heals, to darken significantly and persist longer. Without sun protection, acne marks that might fade within 3 to 4 months can persist for a year or longer. Many acne treatments increase photosensitivity, making skin more susceptible to sun damage. Retinoids significantly increase UV sensitivity. Salicylic acid and benzoyl peroxide cause mild photosensitivity. Chemical exfoliants, AHAs, BHAs, increase sun sensitivity. Vitamin C also increases sensitivity in some formulations. Using any of these treatments without sun protection significantly increases sun damage risk and post-inflammatory hyperpigmentation. Sunscreen comes in 2 main types: mineral, physical, and chemical. Mineral sunscreens contain zinc oxide or titanium dioxide, which reflect UV rays. They're generally well tolerated, work immediately upon application, and rarely cause irritation. However, they can leave a white cast on skin and may feel heavy. Chemical sunscreens contain organic compounds that absorb UV rays and convert them to heat. They're typically lightweight and invisible on skin but may cause irritation in sensitive individuals and require application 15 minutes before sun exposure to be effective. For acne-prone skin, sunscreens labeled non-comedogenic or for acne-prone skin are essential. Many facial sunscreens are specifically formulated to be lightweight and non-clogging. Combination sunscreens containing both mineral and chemical ingredients often provide the best balance of effectiveness and wearability for acne-prone skin. SPF, sun protection factor, indicates protection against UVB rays. SPF 15 blocks about 93% of UVB rays, SPF 30 blocks about 97%, and SPF 50 blocks about 98%. For daily use with acne-prone skin, SPF 30 is the minimum recommended. SPF 50 provides slightly better protection if you'll be outside for extended periods. However, SPF rating says nothing about UVA protection. Ensure your sunscreen is broad spectrum, protecting against both UVA and UVB rays. Proper sunscreen application is crucial. Most people don't apply enough. You should use about 1/4 teaspoon, 5 milliliters, for your entire face. Many people use far less, reducing actual protection significantly. Warm the sunscreen between your palms and gently press it into your skin. Apply it as the final step of your morning skincare routine, before makeup if you wear it. Daily sunscreen application. Oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol, cost $5 to $30 per product and are usually affordable. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-$100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-$500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-$100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments: chemical peels $150 to $300, laser $400-$1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-$300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies: start with over-the-counter treatments, use generic prescription medications if needed, ask dermatologists about patient assistance programs for expensive medications, consider community health center dermatology if cost is barrier, check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines, and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments: bringing full-size bottles takes space and weight. Travel-size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75. Acne in specific professions: pilots, surgeons, healthcare workers, and others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Combining retinoids with other acne treatments provides advanced results. After retinoid tolerance is established, typically 8 to 12 weeks, carefully introducing benzoyl peroxide on different days, perhaps retinoid at night, benzoyl peroxide in the morning or on different evenings, can enhance overall acne control. However, this requires careful management. Combining retinoids with strong treatments too early in the process causes excessive irritation. Wait until you're using retinoids nightly without significant irritation before attempting combination with benzoyl peroxide. Combining salicylic acid with retinoids requires similar caution. Both are exfoliating and somewhat irritating, so combining them immediately is unwise. After 8 to 12 weeks of stable retinoid use with good tolerance, you might use salicylic acid cleanser in the morning and retinoid at night. The salicylic acid provides daytime exfoliation and sebum control, while retinoid provides nighttime cellular turnover and anti-inflammatory benefits. Oral antibiotics plus retinoids represent an advanced combination for moderate inflammatory acne. The antibiotic controls bacterial inflammation while the retinoid addresses cellular turnover and sebaceous gland normalization. This combination is particularly effective for acne resistant to topical treatments alone. However, careful introduction is necessary. If possible, allow 4 to 8 weeks of antibiotic therapy before introducing retinoids, then start retinoids at low frequency and concentration. Hormonal treatments combined with topical treatments represent a synergistic approach for hormonal acne in women. Oral contraceptives or spironolactone address the hormonal root cause, while topical treatments manage surface acne manifestations. This combination often provides superior results to either approach alone. For example, a woman might be on spironolactone plus doxycycline plus benzoyl peroxide, addressing hormone regulation, bacterial factors, and inflammation simultaneously. Chemical peels combined with home treatments provide enhanced results. Monthly superficial chemical peels combined with daily topical acne treatments provide more dramatic results than either approach alone. The chemical peel removes surface impurities and promotes cellular turnover, while daily treatments maintain and enhance the peeling results. Vitamin C plus niacinamide represents a complementary antioxidant combination that doesn't directly treat acne but provides skin-supportive benefits. Both are non-irritating and well-tolerated together. Apply vitamin C in the morning for antioxidant protection, and niacinamide can be included in morning or evening moisturizers. These support overall skin health during active acne treatment. Important principles for combination therapy. Never introduce multiple new treatments simultaneously. If you want to combine treatments, introduce them sequentially. Establish tolerance to one treatment before adding another. For example, establish stable benzoyl peroxide use for 4 weeks before adding salicylic acid to your routine. Use complementary treatments on different parts of your routine when possible. For example, use salicylic acid cleanser in the morning, brief contact, mild treatment, and benzoyl peroxide leave-on at night, extended contact, potentially more irritating. This separation minimizes cumulative irritation. Monitor for excessive irritation. If combining treatments causes significant redness, dryness, peeling, or sensitivity beyond what either treatment alone causes, reduce frequency of one or both treatments. You can use both treatments but at lower frequencies, for example, benzoyl peroxide once daily instead of twice daily, or salicylic acid 2 to 3 times weekly instead of daily. The sandwich method reduces irritation when combining treatments. Apply your first treatment, perhaps benzoyl peroxide, wait 20 minutes, apply moisturizer, then apply your second treatment, perhaps retinoid. This dilutes treatment somewhat and reduces irritation while maintaining efficacy. Some combinations should be avoided or approached cautiously. Vitamin C and benzoyl peroxide together can reduce vitamin C effectiveness, so apply these at different times. Retinoids and strong chemical exfoliants used on the same evening can cause excessive irritation. Separate these if combining. Benzoyl peroxide with niacinamide is generally fine, though separating them, benzoyl peroxide at night, niacinamide in morning moisturizer, is easier. Assessment of combination therapy effectiveness requires patience. Most people need 8 to 12 weeks of consistent combination therapy to determine if it's working well. Acne doesn't improve overnight. Allow adequate time for evaluation. Adjusting combinations based on response is important. If one component seems essential while another isn't providing obvious benefit, you might discontinue the less beneficial component. Conversely, if you're experiencing insufficient improvement, you might increase one component's frequency or concentration, or add an additional treatment, perhaps adding retinoid to an existing benzoyl peroxide and salicylic acid combination. Professional guidance is valuable when considering combination therapy for severe acne. Your dermatologist can recommend appropriate combinations, warn about potential interactions, and guide introduction sequencing. Don't hesitate to discuss combination therapy approaches with your dermatologist. Guide 24, Understanding and Managing Fungal Acne, Malassezia folliculitis. Fungal acne, more accurately called Malassezia folliculitis or Pityrosporum folliculitis, is often misdiagnosed as bacterial acne. This condition presents similarly to acne but results from yeast overgrowth rather than bacterial infection, requiring different treatment approaches. Understanding this condition prevents prolonged ineffective treatment with standard acne medications. Malassezia is a naturally occurring yeast on human skin. In most people, it colonizes skin without causing problems. However, in some individuals, conditions favor Malassezia overgrowth, leading to follicle inflammation and fungal acne appearance. Unlike bacterial acne caused by Cutibacterium acnes, fungal acne results from yeast proliferation. Fungal acne typically appears as uniform, small pustules, often in clusters on the back, chest, and shoulders, though facial fungal acne occurs. The pustules are often quite uniform in size and appearance, less variable than typical bacterial acne. Fungal acne is often very itchy or uncomfortable, more so than typical acne. It often appears or worsens after antibiotic courses, as antibiotic elimination of competing bacteria.
Welcome to this peaceful, gentle space. Take a deep breath in, hold it softly, and then release it with a sigh of relief. Let yourself be fully here, fully present. Today we're going to talk about something beautifully simple, yet profoundly important. How to keep your skincare routine soothing and simple, so it serves your skin and your well-being without becoming a source of stress or complexity. In a world that constantly pushes more products, more steps, more complexity, choosing simplicity is both wise and radical. A soothing, simple routine is one that you look forward to, that feels like genuine self-care, that supports your skin without overwhelming it, and that you can maintain consistently through all of life's changes. Simplicity in skincare isn't about doing the bare minimum or neglecting your skin. It's about doing exactly what serves your skin, nothing more and nothing less. It's about quality over quantity. It's about consistency over complexity. It's about peace over perfection. Let's explore what makes a routine truly soothing and simple, and how to create one that feels like a gift rather than a burden. First, let's understand what soothing means in the context of skincare. A soothing routine is one that calms your skin and your nervous system simultaneously. The products feel good. They don't sting, burn, or irritate. The process feels good. It's not rushed or stressful. The time spent is peaceful. It's a moment of self-care, not a chore you resent. When your routine is soothing, you actually look forward to it. Those few minutes become a refuge in your day, a time when you're caring for yourself with intention and gentleness. This emotional experience matters just as much as the physical benefits to your skin. Simplicity means your routine is easy to understand, quick to complete, and sustainable over time. You're not overwhelmed by choices or steps. You're not confused about what to use when. You're not spending 30 minutes twice a day on elaborate layering. Simple means streamlined, clear, and manageable. Let's build a soothing, simple routine together, starting with the absolute essentials. Every simple routine needs just 3 core elements: cleansing, moisturizing, and sun protection. These 3 things, done consistently with appropriate products, create and maintain healthy skin for most people. Everything else is supplementary. Morning soothing simplicity. Step 1. Gently rinse your face with lukewarm water, or if your skin needs it, use a gentle cleanser. Take your time. Feel the water. Breathe deeply. This is not a race. Step 2. While your skin is still slightly damp, apply your moisturizer. Use gentle upward motions. Feel the nourishment sinking into your skin. Take 3 slow breaths as you do this. Step 3. Apply your sunscreen. This is your daily protection, your shield against the primary cause of skin aging and damage. Smooth it on with care and intention. That's it. 3 steps, perhaps 5 minutes. Your morning routine is complete and you can move into your day knowing you've cared for your skin. Evening soothing simplicity. Step 1. Cleanse gently but thoroughly to remove the day. Use lukewarm water and a cleanser that feels comfortable. Massage for a full minute, using this time to release the day's tension. Feel your facial muscles relax under your fingertips. Step 2. Apply your moisturizer to your damp skin. Perhaps this evening moisturizer is richer than your morning one, more nourishing for overnight repair. Apply it with love and attention. Optional step 3. If you're using a treatment product, perhaps a retinoid or other active, apply it between cleansing and moisturizing, but only on nights when it's scheduled. Most nights you're just doing the 2 essential steps. That's your evening routine. 2 to 3 steps, 5 minutes or less. Simple, soothing, sustainable. Now let's talk about how to choose products that support a soothing, simple routine. For cleansers, choose something gentle that leaves your skin feeling clean but comfortable. Avoid anything that makes your skin feel tight or stripped. Cream cleansers, milk cleansers, and gentle gel cleansers often work well. The cleanser should have a pleasant texture that feels good to massage onto your skin. Fragrance-free is often better for sensitive skin, but if fragrance brings you joy and doesn't irritate your skin, that's fine too. For moisturizers, find one that your skin absorbs comfortably and that keeps your skin feeling hydrated for several hours. You might want a lighter one for morning and a richer one for evening, or you might use the same one twice daily. Look for products with skin barrier supporting ingredients like ceramides, niacinamide, or hyaluronic acid. But don't overthink it. If a simple moisturizer makes your skin feel good, that's enough. For sunscreen, find one you genuinely like wearing. This is crucial. The best sunscreen is the one you'll use every single day without resistance. It should feel comfortable, not sit heavily on your skin, and not interfere with how you want your skin to look. Spend time finding one you like. It's worth the effort. These 3 product categories, cleanser, moisturizer, sunscreen, are your essentials. If you only owned these 3 things, you could have healthy, well-cared-for skin. Now, let's discuss optional additions that can enhance your routine without complicating it. If you have a specific concern, acne, hyperpigmentation, or visible aging, you might add one targeted treatment. Choose one that addresses your primary concern and use it consistently. Don't try to address 5 concerns with 5 different treatments. Pick the most important concern, address it with one good product, and let the basics handle the rest. If you enjoy masks, incorporate one hydrating or soothing mask weekly as a self-care ritual. This becomes your spa night, a time to relax, perhaps take a bath, light a candle, and give yourself extra attention. But masks are optional treats, not essential maintenance. A gentle toner or essence can be a lovely addition if you enjoy the extra hydration and the ritual of patting it into your skin. But if it feels like an unnecessary step, skip it. Your moisturizer provides hydration. Toner is a bonus, not a requirement. Facial oil can be added as a final step at night if you have very dry skin or enjoy the nourishment. A few drops press gently onto your skin seals and all your other products and feels luxurious. But again, this is optional. The key is that each product you add should feel like it enhances your routine, not burdens it. If applying a product feels tedious or you can't articulate why you're using it, let it go. Let's talk about making your routine a soothing ritual rather than a rushed chore. Set the mood. Dim lights in the evening can signal to your body that the day is ending and rest is coming. A small candle creates gentle ambiance. Playing soft music or maintaining peaceful silence, whatever soothes you, transforms your bathroom into a sanctuary. Slow down. Even if your routine only takes 5 minutes, allow yourself those 5 minutes fully. Don't rush. Don't think about what's next. Just be present with the sensations. The water, the texture of products, the feeling of your hands on your face. Breathe consciously as you do your routine. Take slow, deep breaths. This simple act shifts your nervous system toward relaxation and turns skincare into a meditation practice. Pay attention to sensations with curiosity and pleasure. Feel the coolness of cleanser, the smoothness of moisturizer, the way your skin drinks in hydration. These sensations, when you actually notice them, become deeply satisfying. Use this time to release tension. As you cleanse, welcome to this peaceful space of learning and care. Take a deep breath in, feeling calm, enter your body. Exhale gently, releasing any tension. Today we're going to talk about preventing clogged pores, how to keep your pores clear and healthy through gentle, consistent practices rather than aggressive intervention. Clogged pores are at the root of many skin concerns: blackheads, whiteheads, acne, and rough texture. When pores become blocked with oil, dead skin cells, and debris, problems develop. But here's empowering news. Pore clogging is largely preventable through thoughtful daily habits and a gentle skincare routine. Let's begin by understanding what causes pores to clog. Your pores contain hair follicles and sebaceous glands that produce oil called sebum. This oil is natural and necessary. It protects and moisturizes your skin. Problems arise when too much oil is produced, when dead skin cells accumulate faster than they shed, or when external debris mixes with these and blocks the pore opening. Several factors contribute to clogged pores: excess oil production influenced by hormones, genetics, and stress. Dead skin cell buildup from inadequate exfoliation or too rapid cell turnover, heavy or pore-clogging skincare and makeup products, inadequate cleansing that leaves residue on your skin, environmental pollutants that settle on your skin, and touching your face frequently, which transfers oil and bacteria. Understanding these causes helps you prevent them systematically. The foundation of pore clogging prevention is proper cleansing. Cleanse your face thoroughly once daily in the evening to remove oil, dead skin cells, makeup, sunscreen, and environmental debris that have accumulated. Use a gentle but effective cleanser appropriate for your skin type. For oily or combination skin prone to clogged pores, a gel cleanser with salicylic acid can be beneficial. Salicylic acid is oil-soluble and penetrates into pores, helping keep them clear. Use 0.5 to 2% concentration. Double cleansing in the evening helps ensure complete removal of all pore-clogging substances. Start with an oil-based cleanser or micellar water to dissolve makeup, sunscreen, and excess sebum. Follow with your regular water-based cleanser to remove any remaining residue. Cleanse thoroughly but gently. Massage your cleanser onto your skin for a full minute, giving it time to work. Pay attention to areas prone to clogging: nose, chin, forehead. Rinse completely with lukewarm water. However, don't over-cleanse. Cleansing more than once daily or using harsh cleansers can strip your skin, triggering more oil production and actually worsening pore clogging. Balance is key. Regular exfoliation prevents dead skin cell buildup that contributes to clogged pores. Chemical exfoliation with AHAs or BHAs is generally more effective and gentler than physical scrubs. Salicylic acid, BHA, is particularly effective for preventing clogged pores because it penetrates into pores and dissolves oil and debris. Use a salicylic acid treatment 2 to 4 times per week, depending on your skin's tolerance. This could be a toner, serum, or leave-on treatment with 0.5 to 2% salicylic acid. AHAs like glycolic or lactic acid exfoliate the skin's surface, preventing dead cell accumulation. These work well for many skin types. Use 5 to 8% concentration 2 to 3 times weekly. Don't use multiple exfoliants at once or exfoliate daily unless your skin clearly tolerates it without irritation. Overexfoliation damages your barrier and can worsen your skin. Choose your skincare and makeup products carefully to avoid introducing pore-clogging ingredients. Look for products labeled non-comedogenic, which means they're formulated not to clog pores. Common pore-clogging ingredients to be cautious of include coconut oil, though some people tolerate it fine, certain silicones in high concentrations, heavy oils and butters, some waxes, and thick, occlusive formulas if you're very oily. However, ingredient sensitivity is individual. A product that clogs one person's pores might be fine for another. Pay attention to your own skin's response rather than universally avoiding ingredients. For pore-prone skin, choose lightweight formulas, gel or gel cream moisturizers rather than heavy creams, fluid or gel sunscreens rather than thick creams, and mineral makeup or lightweight liquid formulas rather than heavy, oil-based makeup. Remove makeup thoroughly every evening. Sleeping in makeup is one of the surest ways to clog your pores. No matter how tired you are, at minimum, remove your makeup with micellar water before sleep. Moisturize consistently, even if you have oily skin. Dehydrated skin can actually trigger more oil production and more pore congestion. Use an appropriate lightweight, non-comedogenic moisturizer that provides hydration without heaviness. Sun protection is essential, but choose your sunscreen wisely for pore-prone skin. Mineral sunscreens with zinc oxide work well for many people prone to clogged pores. Lightweight chemical sunscreens are also available. Find one that doesn't feel heavy or greasy on your skin. Lifestyle habits significantly affect pore health. Don't touch your face unnecessarily throughout the day. Your hands carry oil, dirt, and bacteria that transfer to your skin and contribute to clogged pores. Every touch is an opportunity for contamination. Keep everything that touches your face clean. Change your pillowcase at least twice weekly. Nightly if you're very prone to clogged pores. Use a clean towel to dry your face, or dedicate a small face towel that you wash frequently. Clean your phone screen regularly as it touches your face and harbors bacteria and oil. If you wear makeup, clean your brushes and sponges regularly, weekly at minimum. Dirty application tools harbor bacteria and reintroduce oil and old makeup to your skin, clogging pores. Avoid heavy, pore-clogging hair products near your hairline and face. Pomades, heavy styling creams, and thick conditioners can migrate onto your face, especially along your hairline and forehead, causing clogged pores and breakouts. Use lighter products or keep hair products away from your face area. Manage oil production through lifestyle factors. Stress increases cortisol, which triggers more sebum production. Whatever helps you manage stress, exercise, meditation, adequate sleep, relaxation practices indirectly helps prevent clogged pores. Stay hydrated by drinking water consistently. When your body is well hydrated, your skin is better able to regulate its own oil and moisture balance. Eat a balanced diet. Some people find that dairy or high glycemic foods increase their oil production and pore clogging. If you suspect a dietary connection, try eliminating these foods for a month and observe whether your skin improves. Consider professional treatments if you're prone to persistent clogged pores, despite good home care. Regular facials with professional extraction by a trained esthetician can help keep pores clear. Professional chemical peels provide deeper exfoliation. Discuss these options with a licensed professional. Retinoids, either over-the-counter or prescription, are highly effective at preventing clogged pores by increasing cell turnover and preventing debris accumulation. If home remedies aren't sufficient, consult a dermatologist about whether retinoids might help. Maintain consistency with your prevention routine. Pores don't clog overnight, and keeping them clear requires daily attention to cleansing and regular exfoliation. The habits you build and maintain matter more than any single product or treatment. Be patient with results. Even with perfect prevention,